Good morning to one and all present here. I am going to present my case, which is isolated eyelid cysticercosis, a rare case report. So, a cyst in the skin of the orbit is a fairly common presenting complaint in general ophthalmological practice. The differential diagnosis of such a lesion includes a number of infective, inflammatory, and neoplastic conditions of various origin. The current case is presented in order to illustrate an example of one of the uncommon infective cause for such a lesion. So, a 20-year-old male presented with swelling in the left lower eyelid since 20 days. There was no history of trauma to the eye, watering, or discharge from the eye. No other significant medical or surgical history was there. On examination, visual acuity of both the eyes were 6/6 and N6. Mass was there in the left lower eyelid, measuring around 3 by 3.5 cm. There was localized edema, mild tenderness. This was firm in consistency, and skin over the mass is freely movable. Transillumination test was negative. No localized lymphadenopathy was there. Rest of the local examination were normal, and right eye examination was also within normal limit. USG-B scan was done. Cystic lesion in the left lower eyelid on medial side, which was around 1.3 by 0.8 cm with hyperdense intramural structure was found. CT scan of brain and orbit were done, which was found to be normal. Complete blood count showed eosinophilia with an absolute eosinophil count of 440 eosinophils per millimeter cube. Stool examination was positive for Taenia solium. And serum IgG was done, which was found slightly raised, that is more than 2.2. A diagnosis of left lower eyelid solitary subcutaneous cysticercosis was made. Patient was started on oral albendazole with 15 mg per kg per day in 2 divided doses for around 8 to 15 days, and corticosteroid 1 mg per kg per day for 4 weeks. Symptomatic improvement was seen with resolution of signs of inflammation. 2 weeks after the completion of conservative treatment, there was persistence of cyst without signs of inflammation, promoting surgical removal of the cyst. A large subcutaneous nodule of fibrovascular tissue was encountered, from which a 8 by 6 by 0.4 mm smooth, thin-walled, cream-colored cyst was removed and subjected to histopathological examination. On histopathological examination, the outer cyst wall consists of undulating tegument covered with microvilli, which contains a central invaginated scolex with suckers and a rostellum containing a row of hooklets suggestive of larval stages of Taenia solium. So, first case of in my discussion part, I would like to discuss the first case of ocular cysticercosis was reported by Sommering, and the larva was demonstrated and extracted by Scott. Ocular or adnexal involvement, which is in my case, occurs in 13 to 46% of infected patients, and in Western literature the most common site is the posterior segment, whereas in Indian literature ocular adnexa is the most common site. And the clinical manifestations depends on location, size, relation to adjacent structures, and stage of development of the cyst. Isolated ocular involvement is rare, with isolated orbital adnexal involvement is an occasional occurrence in clinical practice. Orbital and adnexal cysticercosis, there is a predilection for children and young adults with no sex preponderance. Cysticercosis is easily diagnosed by orbital imaging, which is highly specific, whereas CT and MRI imaging not only confirm the diagnosis but also helps to rule out neurocysticercosis. Therapy must be individualized according to the location of the parasite and the activity of the disease in a given case. Surgical removal is advocated for subconjunctival and eyelid cysticercosis. So to conclude with, intraocular infestation by cysticercosis cellulosae are more common as compared to ocular adnexal involvement. A solitary cysticercus lesion is usually clinically confused with other intramuscular tumors like lipoma, neuroma, neurofibroma, sarcoma, soft tissue myxoma, and hydatid cyst. Orbital imaging is very important in making this diagnosis. Whereas in young and adult living in an endemic area, high index of suspicion is needed for extraocular cysticercosis. Thank you very much.
Okay, so was this a live cyst or a dead cyst?
Sir?
Was this a live cyst or
Sir, inflammation was there, so it must be a dying cyst.
Okay, so you have to look for the mobility, the cyst moves if it is live.
Yes, sir.
And many a times in such cases it extrudes on its own through the conjunctiva.
Yes, sir.
Okay.
But inflammation was there, associated inflammation was there, so it is not a dead cyst.
Okay, there is another second line of drug.
Praziquantel.
Yes. Did you try that?
No, it was with albendazole it worked. So after 15 days, the inflammation was decreased and we could remove the cyst, and then histopathological examination was done because IgG level were not very high, so it's slightly high only. So that's why to confirm histopathological examination was done.
Okay.
So actually, inflammation is more in a dead cyst. So after you give that medicines, there's leakage of the fluid and it may cause more inflammation.
So that's okay. Sir.
Yeah. Okay. So that is there. And the second thing, you have to take the history whether it's a vegetarian or non-vegetarian. It's more common in which? Vegetarians or non-vegetarians?
So he was a non-vegetarian
So it's more common in vegetarians.
due to the salads and.
Okay, thank you.